So 1 in 8 women across the United States will develop breast cancer in her lifetime. Now, October is Breast Cancer Awareness Month. It's an opportunity to make sure that you and your family, you have the right information. Make sure you're taking care of yourselves. So joining us today, Dr. Dalwadi, breast radiation oncologist with UT Health San Antonio MD Anderson Cancer Center. Good morning, doctor.
Good morning. Thank you for having me today.
Thank you for joining us dark and early on a Sunday morning. So right off the bat, what are some of the risk factors of breast cancer that our viewers should know about?
Some risk factors are not preventable, such as age. Older women are more at risk, and being a woman. Other risk factors are preventable, such as obesity, never having pregnant or having a first child at an older age, the use of hormone replacement pills. Other risk factors are radiation exposure or a family history of breast cancer or ovarian cancer.
We talk about getting checked as often as possible. So when should women start getting checked? When should anyone start getting checked? And how often should you get a mammogram?
So women of average risk should begin getting their mammogram at age 40. They should get it every 1 to 2 years. But if you have a history of radiation or many people in your family have been diagnosed with breast cancer, I would encourage you to speak to your physician to see if you qualify for earlier screening.
And we were talking earlier, what does the problem look like specific to San Antonio?
Honestly, in San Antonio, we're really catching up since the COVID era when the pandemic was at its height, making sure that women are getting back into clinics and getting their mammograms on time.
So there is a difference between the 2D and 3D mammograms. Which mammogram should a woman ask for, and really what's the difference?
A 2D mammogram has been the standard of care for decades and honestly is able to detect most cancers. A 3D mammogram is now the standard at most modern facilities because they're able to acquire images in different angles and provide more information on how concerning a lesion is. So think about requesting a 3D mammogram if you have dense breast tissue or a strong family history and just overall at a higher risk of getting that diagnosis. If you're getting your mammogram at a specialized center, especially one with an experienced breast radiologist, you're going to be in good hands.
And speaking of those risks, how can women lower their risks of breast cancer?
So eating a nutritious, healthy diet, exercising, limiting alcohol, and visiting your doctor for regular exams. And of course, doing your mammograms for screening on time will lower your risks of being diagnosed with advanced breast cancer.
And we know being aware of the risks and being aware of your family history is so important. So tell us about the possibility of genetic testing and even counseling.
So most women with breast cancer will actually qualify for genetic screening based on the most recent guidelines. But for women without a breast cancer diagnosis, it's less clear, and genetic counseling may not be needed. If you have a strong family history of cancer, it would be worth talking to your primary care doctor to see if you would be able to get genetic screening to better understand your risk.
All right, Dr. Dalwadi, thank you so much for joining us this morning. We really appreciate your time. Anyone who missed any part of the interview, we're going to have all this information, what you and your family need to know. Just head to the leading SA section on ksat.com.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.